Hi, my name is Dr. Wooten and I'm a board-certified plastic surgeon. Today, we're going to talk about blepharoplasty or eyelid surgery. We see a large number of patients in our practice for this procedure. The usual complaint is that I look tired, but I'm not. There is an upper and lower eyelid surgeries. Upper eyelid surgery removes skin excess. Sometimes it removes a little bit of a muscle, and sometimes it removes small amount of fat pad in the inner corner of the eye. Upper eyelid blepharoplasty can be performed under local anesthetic in the office or under twilight anesthesia in the surgery center. When I evaluate patients for the upper blepharoplasty, I assess brow position, amount of skin excess on the eyelid, and the extent of the eyelid hooding. It is very important to know that patient has to be able to close their eyes completely after surgery. If the brow sits low, then the brow lift has to be done at the same time to avoid removal of too much eyelid skin and prevent being unable to do this in the future. Incisions are usually placed in the natural crease and often extend laterally to prevent puckering. Usually I place non-absorbable sutures that I remove at 1 week. For the lower blepharoplasty, we reposition fat pad. We smooth the transition between the lower and the eyelid and the cheek junction and remove skin excess. This procedure I usually perform under general anesthesia. When I assess patient for the lower blepharoplasty procedure, I evaluate the skin excess, skin color, fat pad visibility, and the eyelid tone. The incision can be either well hidden in the lash line or just underneath, so you see the fine line, and it might extend to the lateral portion of the eye to remove visible skin excess. During this procedure, I reposition the fat pad from where they cause fullness to the area where it's deficient in volume. To ensure that this fat pad stays in place, I place few sutures that look like tiny little puckers, and I usually remove them at 1 week. With the upper and lower blepharoplasty, it's important to know that it takes up to a year to heal. Upper eyelid heals faster. Incisions first look red, then pink, then look white at 6 months. Meanwhile, swelling from the lower blepharoplasty can persist up to 6 months to almost to a year. There can be a temporary increase in dry eyes up to a year, especially if you have dry eyes to begin with. Dry eye and other pre-existing eye conditions should be discussed with your doctor prior to blepharoplasty. An important topic with the eyelid surgery to discuss is your blood pressure. With this procedure, it is very important to make sure your blood pressure is within normal range, around 120/80, because the increase in blood pressure can cause additional bleeding and excessive bruising. If you're currently taking blood pressure medication, it is important to continue taking it prior to your surgery as well as after your surgery. Changes in medication should always be discussed with your doctors and our office. Another very important topic is blood thinners. All medications and supplements that thin the blood must be stopped. It is great that you're taking them otherwise, but if you're getting your eyelid surgery, you really have to go over your med list to avoid way ahead of time and stop all potential blood thinning medications pending your doctor's approval. It is important to avoid medications such as Botox to be injected in your forehead and near your brow and eyes for about 3 to 4 months prior to the procedure, because it can relax the forehead and make it appear that you have more skin than you actually do. You do not want to have too much skin removed during this procedure. After this procedure, it's important to avoid strenuous activity and keep your face elevated for about 6 weeks, as putting your face down can increase swelling and pressure to your upper and lower eyelid and can affect your healing. You can leisurely walk until 4 weeks, but do not elevate your heart rate and blood pressure for about the same time. No treadmill walking, please. It's important to sleep with the head elevated for at least 2 weeks, but maybe up to 4 if you can. Often we recommend neck pillow to prevent rubbing your incisions during sleep. Makeup and products near the eyes should be avoided for about 2 weeks, and contacts should be avoided for about 6 weeks. It's important to be aware that your eyes might feel dry, especially if you have dry eyes to begin with, but they should feel close to preoperative status at the year after surgery. The goal for this surgery is to achieve a natural, rested, and relaxed look for your face. I strive to achieve natural, harmonious results that should last you for years to come. To schedule your consultations, call our office at 724-759-7777 or visit us on our website at blepharoplasticsurgery.com.